We're trying a new format for Queen's Park Report, balancing the dictates of social distancing with the need to continue our dialogue with MPP Dave Smith. This is our first show with this format, so bear with us. We're going to see what happens. Anyway, welcome, Dave, to this format.
Thanks, Ken. I'm glad to be here talking to you.
Well, thank you so much. I was getting long hair, so I didn't know if I was going to have a man bun or a mullet. So, we're going to see how this all turns out. I was going through our notes and noticed that our last session was actually March 13th. A lot of water under the bridge since then, with basically the daily news of not only the impact of the coronavirus in terms of cases and unfortunately deaths and their location, but we've seen things like healthcare workers and the healthcare environment and PPE. We're looking at titrating the opening of the economy. We've seen things about supply chain. We've heard about testing and all the pieces that are really in part to help us buy time to either get a cure or a vaccine, which, depending upon who you listen to, could be a significant period of time. So do you want to give us an update on sort of how you think Ontario is doing? And I think perhaps your efforts in supporting folks caught in the economic consequences of this pandemic?
I think Ontario has actually done very well considering where we started back in March. If I do a comparison with New York State, they're about 50% larger than what Ontario is. We're just over 1,300 deaths now in Ontario as a result of COVID-19, and they're at about 26,000 deaths. So using New York State as a comparator, I think we have done very, very well. New terms have come out from this. You've heard flatten the curve, plank the curve. I don't know how many times I've referenced PPE as part of COVID-19. And these are things that we would never have considered talking about previously. A lot of the measures that we have taken, though, a lot of the staying at home, the isolation, quarantining, washing your hands, those are all things that have made a massive difference for us. And we're actually in a pretty good shape today. If you look at what our projections were at the end of March, what we thought April was going to look like, we didn't turn out to be nearly as bad. And that was a result of people following the right measures and taking this seriously.
I am watching the ratios of the incidents and obviously the comparators to the United States, how Canada seems to be doing so much better on a per capita basis, both in terms of incidence and mortality. Perhaps speaks to the healthcare system or social net, access to services and a bunch of things. So that plus social distancing seems to have positioned us well if we ever were to do a global case study on how we fare.
Yeah, I think you're bang on with that. We really have done a lot of good things. At one point, at the beginning of March, we had about 1,200 ventilators in total across all of the hospitals in Ontario. We're now sitting at about 3,000 ventilators if we were needing them. We peaked at about 210, 212 people in ICU units that were using ventilators. We're now down around the 150 to 175 mark. So we've done very well that way. I think that when you do the postmortem on all of this, the case studies that will have been done, the academic research on how Ontario fared and what we can take as best practices moving out of this, Ontario will be in a very good position moving forward on our healthcare system.
And I think one of the points that's come through all of this is how tightly intertwined the economy and healthcare are. You can't have economy without health. And if you need healthcare, you got to have a robust economy. And therein lies the dilemma that all governments are facing.
Very much so. When people have disposable cash, they have hope. They are able to do a lot of different things. When they don't have that disposable cash, they don't have hope. They get sick for various other reasons, and the two of them go hand in hand with it. Mental health is something that can never be minimized, and some of the mental health challenges that we're seeing now as a result of the isolation, of the self-discipline that's required to fight COVID-19. These are things that even 3 months ago, no one would have ever considered would have been part of the challenge that Ontario is facing. And it is now the reality today.
One of the things obviously we're concerned about is the net effect economically of this, both in terms of the money that's being spent and allocated to create the safety net for industry, business, individuals, and organizations, as well as sort of the tax revenue that's also been lost because of no transactions, no retail sales tax. Any sense that how we're going to approach, I know it would be hard to predict a number, but how we're going to approach, though, the incredible financial legacy this is going to place not only in obviously this year's budget, but as we go forward, and that it's going to be universal around the globe.
I think when you look at what's happened and what the challenges that we face with COVID-19 in this crisis, the former governor of the Bank of Canada described it the best. He said that if you take a look at the economy and think of it as a road, you're driving along the road fine, and you have a massive sinkhole in the middle of the road. And there's two ways that you can deal with it. You can have the vehicle go down into the sinkhole, get lost, and try and dig its way back up, or you can try and fill that sinkhole in other ways. And what the government has tried to do, both federal government and the provincial governments, we have tried to find a way to fill that sinkhole so that we don't find ourselves in a position where the economy, which is the road and traveling on that road, we don't go down into that sinkhole. We have a prolonged economic recession and then try to fight our way back out of it. We're trying to find ways then to lower or lessen the size of that sinkhole. On the federal side, there's almost $200 billion is what they're talking about as a deficit as a result of this. Provincially, we're looking in the neighborhood of $17 billion as an added deficit as we get through this. The longer that it takes, obviously, the more economic harm that there is, but we're seeing some good signs with respect to the illness itself. And we're in a position where we're looking at how we're going to open businesses back up in Ontario. The sooner that we're in that health position to do it, the better we'll be in for an economic health. When you look at worldwide, global supply chains have been significantly affected. And Ontario is not immune to anything else that's going on in the rest of the world. We don't have transportation right now that we had previously. It's not like airplanes are flying from location to location. All of that has been shut down. Even shipping lanes, there are less product coming in on shipping lanes. Our manufacturing base that we have relied on in China, in India, in Mexico, they've all been affected by COVID-19. So we're in a position here in Ontario now where we're looking at how do we redevelop our own manufacturing base, and how do we do it in a way that is sustainable long-term? Gearing up for something in a short term, in a 3-month period or a 4-month period where you're making production, it's difficult to get the economies of scale to keep the cost down on it. So we have to be looking at then how do we have some of those industries sustainable long-term after we get through this COVID-19.
Repatriation of entire industries with global capital and you know all those kinds of things is a real long-term solution, and it's going to be a significant issue. As you're going through this, there's the federal government and its financial solutions and mandates, the province its financial solutions and mandates, and municipalities. How have these three levels of government kind of worked together or learned how to navigate what it takes? Because many of these issues cross all three boundaries.
The key to it really has been that all the levels of government have recognized that we have to work together on all of this. It's not a case where one government can intervene and do something. We all have to do something with respect to it. The municipality is waiting for direction from the province. The province waits until the federal government does something. In essence, the federal government has opened up the bank vault, for lack of a better term. They have come out with a number of different financial programs for us. The provinces then have to fill in the gaps on all of that. It isn't prudent for us to introduce a program that matches something that the federal government does or is going to do at a later date. So we have to wait until the feds come up with their program. We see how that affects Ontario because our needs are different than Quebec or Alberta or Prince Edward Island. And then we adjust what we're going to do at the provincial level. That means that we also have to do things with the municipality. We're directing funds down to the municipal level because they are closer to individual people, and they can implement a lot of those services that we're trying to do. It puts a challenge on the municipality because right now revenues are down and they do not have the ability to run a deficit where the federal government, the provincial government does. As we come out of this, that'll be one of the economic plans that we'll have to work on. How do we make sure that municipalities aren't in a position where they can't deliver services because they weren't able to collect things like property taxes?
Yeah, and one of the main ones between the municipalities and the province is education. The education system is incredibly complex in terms of its cost and revenue sharing. And we're going to, I gather, we're pretty well done this academic year. So a lot of churn in that whole sector, right?
Very much so. We've got to the point where we have tentative agreements now with all of the teachers' unions. That was something that probably didn't look like was going to happen prior to COVID-19. Priorities have changed for everybody involved, and we've been able to come to an agreement on it. So we'll be in a good position for the next school year to start. We haven't given up hope yet on this school year. Schools are closed until the end of May. If there's an opportunity for students to go back in June to finish those last things that they'll need to complete the school year, we're holding out hope that we'll be able to do that. But if you look at what's happened in the education system itself, it has changed significantly. We're talking about learning at home now with kids. We're talking about e-learning as the norm for all of those students from kindergarten all the way through to grade 12. We've had to make adjustments for grade 12 students so that they can graduate. And we've had to come to agreements with the different colleges and universities on what that last term of high school is going to look like for these kids so that they're not in a position where they essentially lose a year and have to give up going to college or university next year. It's been a big challenge, but I think that everybody in the education sector has risen to the challenge.
Okay, with that, we'll take a short break. Thanks, Dave. We'll be back with you in a moment. Hi, welcome back from the break. This is Queen's Park Report with MPP David Smith for Peterborough-Kawartha. I'm Ken Tremblay, your host here on Zoom via your TV. Anyway, Dave, a particular note, the healthcare supply chain, ventilators, PPE, and as we reopen society, the need for masks, there's just such a huge implication. The coordination between public health and institutional health and the Ministry of Health and long-term care. We've seen, unfortunately, a real focus of this COVID outbreak in the long-term care settings, which is very concerning to many. So where do you think we're going to take this the health portfolio and how we kind of not only deal with the COVID, but going forward?
Well, let's talk about PPE to start off with. Prior to the beginning of March, we didn't have a single company in Ontario that was producing masks, whether they were N95 equivalent or surgical masks. Now we're at a spot where 25 companies are able to produce those masks here in Ontario. We were very reliant on the worldwide supply chain for all of these products. We didn't have domestic supplies of it. We now have a good, solid supply of disinfectant, of hand sanitizer, of masks, of face shields. What we are still lacking from our domestic supply chain is surgical gloves or gowns. Those are two things that we need to ramp up as well. When we look at what's happened in long-term care, our long-term care facilities, let's be realistic about it. They have been underfunded for probably 20 years. We've seen some serious vulnerabilities there. There were changes in a lot of the protocols as a result of COVID-19. And again, this is one of those cases where when we come out of COVID-19, the best practices that we developed as a result of this are things that will carry on in long-term care. How do we make adjustments to it so that they have proper PPE, they have proper staffing, they have proper staff training, that they're not in a position moving forward where some of our most vulnerable citizens are that much more vulnerable. A lot of the long-term care facilities, and I'm going to single out one in particular, Fairhaven as an example. They've done some fabulous work in planning for COVID-19 once it started. The isolation plans that they've put in place, those are things that can be carried through for other infectious diseases once we get out of this crisis as well. COVID-19 has been an eye-opener for everybody with respect to health. And I know it was said after SARS that we wouldn't be in that position again. This case with COVID-19 is far more severe than what SARS ever was or what anyone ever thought we would be in. If a disease has mutated like this, we're going to get them again, and it is probably not going to be 100 years from now. It's most likely going to be much sooner. But the lessons that we learn from this are ones that will carry us through very well the next time it happens.
See, that's the challenge we have as policy and funding. You try to fund at the average, you try to whittle down bad performers, you try to say, look, we're going to get 2% when you know the BPI is 3%, work smarter, and we do all these things to try to reduce the spend. But then we find out when something really breaks through every known threshold, we are caught woefully inadequate. And when nursing homes or long-term care are dealing with very, very small margins, and next thing you know, thousands of dollars a day are suddenly going in PPE, things that were never, for level of care and acuity, it was never designed in the funding model. Therein lies the challenge.
Well, I think we started in the right direction prior to COVID-19 with our procurement changes. I'll give a great example of it. If somebody's in a car accident up in North Kawartha and the ambulance comes up there, they put an IV in the patient. When they get to PRHC, they take that IV out and they put a different one in because the paramedics use a different supplier for IV products than what the hospital does in Peterborough. And then if they had to be airlifted to a Toronto hospital, Orange Air uses a different IV product than what we use in the Peterborough hospital, so they would change it again. And then if they landed at Toronto General, it was the fourth time that they would change that. And these are all things that we were looking at from the procurement side. And these are things then, as we come out of COVID-19, it's going to make perfect sense to implement some of those.
Yeah.
And after SARS, sorry, Ken.
And it's oxygen tanks. It's you don't leave your monitors behind. You got to take them back because they belong to the ambulance, not the hospital. Like, there are just dozens and dozens of examples that in these handoffs, equipment, supplies, gizmos, gadgets become problematic in the handoff, let alone the continuity of care.
With SARS ending, one of the things that was decided on and was a good practice was a stockpile of all of these products. Great concept, come up with a stockpile that was there for pandemic purposes. The problem with that implementation was they never rotated any of the stock through. So we got to a point where those masks expired. It wasn't that the respirators weren't going to work, it was that the elastic bands on them started to rot. So you had nothing to hold that to your face. Moving forward, we're going to have that stockpile, but the stockpile is going to be rotated through. So we'll keep that stockpile fresh and we'll be distributing it out after a period of time back into the healthcare system. Simple things like that that weren't thought of that will make a big difference for us as we move forward.
Yeah, it's maintenance contracts, it's rubber seals, it's lubricants, it's motors, preventative maintenance, because when you do need it, you don't want it to have to go for servicing before you can put it into, like, yeah, you're quite right. I mean, this is going to really bring some big holes in how we kind of look at all of this. Flattening the curve was really to give us time to get both a cure and perhaps a vaccine. And we're watching the news now that literally dozens and dozens of research centers are working diligently to kind of get something that is effective and safe and could be produced on, at the billion dose level kind of thing. That's global. Any sense of how Ontario is contributing to that, not only for ourselves, but in terms of Ontario has been very prominent in international research in polio or in vaccines and things like that?
We've got some really good research universities here in Ontario. We have a number of institutions that do a lot of very good research. What we've done with COVID-19 in particular is we've invested an additional $20 million in our universities and other research institutions specifically for COVID-19 research on things like a vaccine, but also on other types of treatment, on different ways that you can produce things that will be effective in the fight. Trent University in Peterborough, great example. They are going through a process of decontamination on N95 masks. They've proven in concept that it will work. This is another one of those great things that we're seeing with our universities, with our research people, coming up with innovative ideas to make sure that Ontario is never in a position again where they can't do something, and so that Ontario is very well positioned in the fight against COVID-19 itself.
Now, we're putting a lot of hope in vaccines, but you know, there are these anti-vaxxers, whether it was measles or just a seasonal flu. A lot of people were taking exception to public policy to make this. Do you think attitude's going to shift if we were to find a vaccine for COVID, that now what we've seen a global pandemic, what it can do and how it is manifest, that you know, the notion of vaccine uptake will have to improve?
I think what we're seeing is a real split between people who were anti-vaccine and those who are pro-vaccine. And you don't have to look too far to see the effects of anti-vaxxers. Just take a look at spring break down in Florida and the number of kids who went down to spring break. They didn't think that it was going to be an issue, and then they got infected. I've seen comments, I've had a number of people reach out to my office about the vaccination for regular flu season doesn't work very well, so why would we think it'll work for COVID-19? Well, with the flu season, we're vaccinating against one or two different strains of influenza, hoping that we're getting the right one. When we develop a vaccine for COVID-19, it's specific to COVID-19. And I'm going to point to polio as a perfect example. We created a vaccination against polio, and it has effectively been wiped out in North America. I'm one of the last generations to really have to worry about getting chickenpox. I had chickenpox as a kid. We developed a vaccine for chickenpox. Very, very rarely do you see someone with chickenpox now in Ontario. When you develop a vaccination specific to a specific disease, it's very, very effective. And I think moving forward, you're going to see more and more people who were on the fence about whether vaccination works or not. They're going to point to COVID-19 and recognize they don't want to go through it again.
That's going to be really important. On top of everybody is opening the economy and trying to find a way that balances that, again, the flattening the curve, but making sure the economy is on a solid road to recovery without, quote unquote, a rebound or a second wave. Any comments about how you see the reopening going and what assurances you might want to give to the riding?
Yeah, actually, Ken, there's a lot of things with opening the economy back up again. We've got a number of different things. We've seen a lot of businesses that have basically shuttered during this. You see the tourism side of it, how much of an impact tourism had in our community. And I'm going to touch on one in particular, and that's sport tourism. I've been appointed to be on the command team for our recovery, economic recovery for amateur sport. And a lot of people would be sitting back saying, what does amateur sport have to do with recovery, economic recovery in Ontario? Last year in Ontario, $13 billion was spent on amateur sport between registration fees, new equipment for players, field rentals, sports facility rentals, $13 billion. There has not been any amateur sport conducted since mid-March. So bringing amateur sport back up is one of those things that will help the economy. On the team, I'm working with representatives from the Ontario Hockey Federation, from the Canadian Olympic Association, from Variety Village, from Special Olympics, from a whole host of others. And I want to point out for all of those Toronto Maple Leaf fans, we have that one piece that we can use against the Ottawa Senators, and that's that the Ottawa Senators are on the amateur sport table with us.
Okay. And as we wrap up, I know we're going to continue to monitor this, and it'll probably factor into future shows. I guess because of tourism, you know, this is going to be important for Peterborough-Kawartha. Everybody's waiting to get their boat in. I know your office is probably the repository or website for people with an update. So with that, we'll hopefully keep up to date, and we'll see you next time. Thank you, everybody, for watching this edition of Queen's Park Report. I'm Ken Trombley, your host.